3 years ago, Connor Sparrowhawk had an epileptic seizure and drowned in a bath at the mental health unit he was staying at. The 18-year-old, who also had autism, had been left alone. An inquest concluded his death was avoidable. Ever since, Connor's mother and stepfather have fought to make sure lessons are learned. But a report out today finds the trust which ran the unit, Southern Health, is still failing to protect its patients from harm.
You know, the findings are so damning of the leadership at the trust. It was harrowing, and it's depressing because they just hadn't improved. You know, there's so many things that they just haven't improved over years now.
Connor died in July 2013. Over the next 2 years, hospital inspectors gave 3 warnings to Southern Health about patient safety. Last December, a report exposed how 450 deaths had not been properly investigated by the trust. But when inspectors visited in January, they found trust bosses still didn't have adequate plans to improve, and Southern Health was ordered to make immediate changes.
The organisation had not learnt from its past mistakes and had not rectified problems that we'd identified in the past, which is why we've escalated the action, because this is a failure of governance and leadership within the organisation.
Last night, the chairman of Southern Health's Board of Governors, Mike Petter, resigned. Another member of the board went this morning. But the chief executive, Katrina Percy, has not quit. She had other commitments today and left it to another senior manager to respond publicly.
We know really clearly what we need to do, and we really want to go ahead and make those changes. I think removing the leadership at this point can only destabilise the organisation. I think it would make it harder.
Connor's parents are frustrated that their battle has not led to a complete change of management at Southern Health.
You know, the whole sort of process of fighting against Southern Health has just led to all these failings being uncovered in a way that it shouldn't be families doing that, and it just demeans really Connor's memory and everybody else who's been harmed through this poor practice.
It took the death of this young man to expose unsafe care at Southern Health's patient units. But almost 3 years on, the changes needed to prevent a similar tragedy still haven't happened.